All right, good evening, everyone. Child psychology module number 18 is what we are getting into. My name is Nadeem Sikander. Once again, thank you all very much for joining me tonight. This module is about behavioral problems. What we will be looking at is the signs of the behavior problems, understanding bad behavior and conduct disorder, long-term effect of behavior problem and conduct disorder, understanding the diagnosis of conduct disorder and behavior issues, and we will also be looking at specific treatment of conduct disorder and the behavioral issues. In this module, these are some of our 5 objectives to look at. So we have covered in the past modules, we talked about the development part of children, where we looked at the nature and nurture. We looked at the forming of relationships, and we also looked at the self-esteem part. Now, in this module, we will cover something that many parents deal with, which is everybody knows, that is the behavioral problem. Though all children have moments where they misbehave. In some cases, this behavior cannot be controlled by the parents. So at that point, when you think that's the case, it is best to seek professional help. The signs of behavioral problems. All children have behavioral issues at some point, and they often go through different phases of behavioral issues as they age and become independent. Now, if you remember from the previous modules, we talked about in self-esteem that the younger group, the younger children, the less they are aware of themselves, the more of the self-esteem they have, right? But you can see the confidence in them. The more they know about themselves, and the more they know about their surroundings, the self-esteem and the confidence begins to, disappear gradually, or things become more challenging. So most children go through 2 challenging phases where they push the limit on behaviors. One, toddlerhood, and the other is adolescence. Now, but most of the time, parents, caregivers, and teachers will come together to overcome that challenge. So they come to help and rescue. Occasionally, children will have an outburst or tantrum, and that is really nothing to worry about for parents or the caregivers. Now, serious behavioral problems and common signs include the following. Children who continuously exhibit bad behavior for several months, for example. Children who are repeatedly aggressive, disobedient, and cheeky when after they're disciplined. Or children who seriously break the rules in school or at home, right? Or behavior that is more than simple mischief or being rebellious. Behavioral issues and conduct disorder. Sometimes the behavior of a child will affect their development and ultimately interfere with their ability to lead a life that is considered to be normal. When behavioral issues get this severe, experts call it a conduct disorder. Now, in younger children, the same behavior is known to be oppositional defiant disorder. Children who have conduct disorder might commonly get into physical fights. They might lie, cheat, steal without any sign of guilt or remorse when they get caught. So you watch these signs. Now, these children refuse to follow the rules either at school or at home, and they often break the law as they get into the teenage years. Now, they also push the limit of teachers, parents, the caregivers. They might stay out all night. They might not go to school during the day. Teenagers with conduct disorder often take risks with their safety getting into issues that are not safe for them, as well as using of illegal drugs and whatnot. Now, conduct disorder can cause much stress to the children, so who suffer from it, right? But at the same time, it causes stress on the family members, friends, or at school as well. And even in some cases, this behavior also costs communities. And these children often find that it is difficult to make friends, and they have difficulties when attempting to make friends, and then they're more geared towards negative companies and do negative things. Though these children might be bright, right? But they often do not do well in school. They could be bright, but they're not going to do well in most cases in school, and are generally are near the bottom of the class when compared to their peers. Not because they're not intelligent, it's just because their behavior is costing them their academics and their learnings. They're learning. Internally, these children might feel as if they are worthless, and if they cannot do anything, and they cannot do anything successfully. It is also common for them to exhibit anger and blame other people for their difficulties in life, and they do not know how to make positive change. So that generally is the issues with the conduct disorder. Now, the causes of oppositional defiant disorder and conduct disorder. There is one cause of conduct disorder, and only recently are professionals starting to understand that there are several possible causes, events, or conditions that might lead to conduct disorder. And we'll look at those in the next slide. Children are more apt to develop oppositional defiant conduct disorder if they fit into the following categories. Now, for example, they possess genes that may lead to antisocial behavior. So it could be something that is part of their genetics. They show difficulty when learning accepted social interaction and behaviors. So they don't really necessarily find it easy that, kids that are generally accepting the social interaction is very difficult for them. They show a temperament, and that is difficult for others to handle. They have reading and learning difficulties, which makes their life more difficult to understand, or for example, to participate in the classroom. And they get bored, and they misbehave, and they feel that they are stupid. They show sign of depression. They have history of having being abused or bullied. They show signs of hyperactivity, which causes difficulties with paying attention, self-control, and following the rules. And they also surround themselves with the children who generally have behavioral problems. So they kind of work well with those who are already on the spectrum, where they're causing more of behavioral issues. So the boys are more likely than the girls to have behavioral problems, to be diagnosed with the conduct disorder. In some cases, parenting factors can come into play with conduct disorder, including issues with disciplines or disorganization of the family unit. So obviously that could also cause a conduct disorder. Parents might also make things more difficult for the children or for the child with behavioral issues, such as having too little attention to the times when a child exhibits good behavior. So whenever a child does good, you pay no attention. But whenever a child does something bad, a parent would immediately jump on it and says, why would you do that, right? So you want to pay attention to the other part of the child's life where he or she is behaving well. They might also be too quick with their criticism or too flexible with the rules that they create for their children. right? Additionally, they might not supervise their children correctly. That's also possible, that you don't know how to supervise your child, or you're too quick to judge, or you're too quick to be very critical on providing criticism. The long-term effect of dealing with conduct disorder. The typical person who is diagnosed with conduct disorder is male, and he generally has been previously diagnosed or shows sign of having attention deficit hyperactivity disorder, which is the ADHD. Now, he's also usually categorized as having a lower intelligence. That not necessarily be the true. I mentioned that in a previous slide. This may not be true. It's just that the behavior is constantly costing the child to be considered as, or to be categorized, or to be labeled as that he doesn't know much, right? So this does not mean the females cannot have a conduct disorder. They can also have conduct disorder. It's just more so towards the boys is what the findings are. However, if it does not mean that every very bright person cannot have disorder. So you can have kids that they're very smart having the same disorder. You can have girls having the disorder, and you can have the kids who are generally having this conduct disorder. So research shows that the earlier these issues start, the higher the risk that the young person will engage in criminal acts or violence. If nothing is done to control and eliminate the behavior, a person might engage in behavior like this for their entire life. So if that's just the research that suggests that, if they continue to do what they are doing, they will eventually be getting into the some criminal activities and creating some violence and whatnot. And it's better to do control and to eliminate these behaviors. So otherwise, it could affect him for the entire life. The diagnosis and the treatment for conduct disorder and the behavior issues. The diagnosis of conduct disorder is done based on the signs and symptoms that have suggested a person that has the conditions, and we'll look into that. So what are they? So if these signs are present, a doctor usually starts the diagnosis with a complete psychiatric or medical history. The doctor might take a series of lab tests and whatnot, and look for the signs of the condition such as depression or ADHD. If a doctor cannot find the physical issues or symptoms, he or she will refer the child to a mental health professional. A psychiatrist or a psychologist will use a series of assessment tools to evaluate the child. They will also then base diagnosis on the child's symptoms, the observation of the child's attitude and their behavior. They might also rely on the teachers and parents who might be withholding some information that could be very useful in understanding the symptoms. Earlier diagnosis will give the child the best possible outcome, as I mentioned earlier. Earlier intervention could find you better solutions. Depending on the severity of the behavior issue, the treatment is often given across several settings, such as at home or in school. The actual treatment will depend on the development, circumstances, and the age of the child. Now, it is imperative that the family supports the child during the treatment process. So I think that's another critical piece of information, that when your child is under some sort of a therapy and some sort of a support system given to the child, you as family needs to buy into it, and you need to show your support. Focusing on identifying specific problems and looking at the child's strengths are also crucial in the process, and this can improve the outcome for those with conduct disorder. So make sure that when the child is getting the help and the support. The family support is also very important. Focus on the positive, focus on what are you being told and how to reinforce those positive messages. Assistance for behavioral issues might involve supporting the child to increase positive social behavior. They should be encouraged to control the action that are antisocial and destructive. Right? It's how you talk to the children. So home-based help. Many parents and caregivers find that they fall into the trap of only focusing on the child's bad behavior, right? They fail to notice when the child is performing the right actions, for example. It is often difficult for parents and caregivers when a child has been diagnosed with a conduct disorder. Some parents and caregivers even begin to fear their children, or they're embarrassed or they're ashamed that the child has a condition or the child's actions are not. So you go someplace and your child, does something that embarrasses you, right? But that's really, you can't really do anything about it. It's just a condition that you're helping your child to come out of it. I have a teacher of mine who I asked these questions, and she mentioned in one of her lectures that she says that she has her son who was going through these issues, and she said usually when I go to places, obviously her son was on medication. She said when I go to places, I usually tell people where I'm invited that my son is I don't want to call out the condition. But she mentions that my child is, have some behavior, he just doesn't even antisocial. So I'm giving him medication, but I just want you to know that if that's okay, he can come. If you feel that that's not the case, I don't really need to come. So it's like kind of throwing things out there earlier if that's the case. To make people aware of that your child is going through, but there's nothing to be ashamed about. There's nothing taboo about. It's just that, these are the social norms that we have created, that if your child is this, you're not supposed to be going to gatherings, or you're not supposed to doing A, B, and C. The most important thing that you need to do is to find help. These adults often feel helpless, these parents and caregivers, and they do not know how to manage their child on their own. So they feel like that they are failures. Many parents and caregivers find that they fall into the trap that I mentioned earlier, that they always look at the negative but don't see the positive. Over time, the child will realize that the only way the child can get attention is when he or she misbehaves, right? Most children and even teenagers require much more attention from those who care for them, but they often do not know how to get this attention. So what they do is they misbehave, they behave in a negative manners. They still feel that it is better than to be ignored. Right. So with children, parents and caregiver will often find that fair and consistent discipline is the best way to handle the behavior of their child. And they should also offer love and positive praise. However, in many cases, implementing this can be very difficult. And for some parents, they may require some assistance, such as a parenting group, or they can, talk to some other parents. One of the best things you'll find is when you talk to other parents, you joining group, you find you're not alone in this process. You will find other parents, other caregivers who are going through the same issues. And when you combine, or when you join forces, you get to start sharing your tips and your ideas and who you're seeing and what psychologist is working for you, what therapist is working for you, what type of therapy that it requires. So it's like people are on a different level when it comes to dealing with their children, but joining parent groups can help you overcome that. Now, obviously, this is home-based help, this is school-based help. Obviously, many people who have behavioral issues struggle with their homework, with their classwork, and they cause a lot more additional stress. School staff can help, of course, providing a behavior support, and they can also help child does better socially in the school. These young people often need assistance with the social skills, so school can provide that, teachers can help that. Some children also need individual support in the classroom, and they need an assessment for their learning difficulties, right? So you can also perform that. When these problems become very serious, very severe, some children will require special education placement or even new schools if the behavior continue to persist, so they can manage it better in a different setting. Community-based help, which is also when behavior continued to become an issue and persistent and it's severe in nature, the child is suspected of having conduct disorder, the parent or caregiver should reach out to the child's pediatrician for assistance. These types of behavior often indicate the child must see a specialist, and in this case, the pediatrician can make further referral to other professionals. You heard the phrase that it takes a village to raise a child, which is very true. You need a communal support. You need school that comes along to help you, your teachers, your psychologists, your medical professionals, and of course, people at home. This entire team works together. So parents, school, all of you come together to provide help to the child. The team members will assess an issue the child is having, and they will suggest different ideas to improve their behavior. Assessment and treatment of other conditions might also be done in this process. Conditions such as anxiety, hyperactivity, depression, other behavioral issues. Social skills, groups, talking therapy, behavioral therapy, and are often used as a treatment. And the goal is to help children learn to express themselves appropriately and to manage their anger effectively. That's the goal. So it's not to get rid of it. Of course, the ideal thing is to get rid of these issues the child is facing, but it goes through, it works through that you to making a goal that you lessen the issues, the anger management, that the child is expressing anger effectively. The child is, coming along, expressing their feelings appropriately. That's the goal. In conclusion, folks, several behavioral issues are not extremely severe. Behavioral issues are not commonly in children. However, approximately 4.5 million children in US aged 2 through 17 suffer from the diagnosed behavioral problems. Behavior issue might be caused by a physical or mental factor, and in some cases by the environmental factors. So that concludes our session number 18. Thank you all very much for watching again. Take good care of yourself. We'll see you on module number 19. Have a wonderful rest of the night.